Good evening, my name is Melissa Blanco and I'll be doing today's media showcase on the subject of obesity. Obesity is an excessive accumulation of fat in the body. This usually refers to individuals who are more than 20 to 30% over established weight standards for height, age, and gender. And they utilize the body mass index in order to determine generalized weight for height, age, and whatnot. The body mass index establishes weight adjusted for height. The population that's affected by this, I would say, disease. In 2017 to 18, 42.4% of the US population was considered obese. Severe obesity in adults was 9.2% higher among women, highest among adults ages 40 to 59, drastically increased from 1999 to 2000 to 2017 and 18. The severe health risks for this disease include, but are not limited to, coronary heart disease, end-stage renal disease, stroke, type 2 diabetes, and certain types of cancer. In 2008, the estimated cost of obesity in the US was $147 billion. And then here's some statistics by race, age, and socioeconomic status. As you can see, the highest category affected by this disease is non-Hispanic blacks at 49.6%, closely followed by Hispanics at 44.8%. Then we have non-Hispanic whites at 42.2%, and the lowest category is non-Hispanic Asians at 17.4%. As far as ages, the highest category for age is young adults 20 to 39 at 40%. Middle-aged adults ages 40 to 59 at 44.8%, and adults older than 60 at 42.8%. And as far as the socioeconomic status, overall men and women with college degrees have a lower rates of obesity compared to those with lesser education. Now, some treatment options are obviously health eating plan and regular physical activity. We have changing your eating habits, weight management programs, weight loss medications, weight loss devices, bariatric surgery, and special diets. Some people who struggle with obesity may be unable to lose enough weight to improve their health and are unable to keep from regaining the weight. In these cases, a doctor may consider treatment options including weight loss medicines, weight loss surgeries, and or devices. Now, as far as for my own testimony, I started putting on weight when I was 20 years old. I was pregnant with my first child, and due to complications to the pregnancy, I had to take steroids and I was on bed rest. I gained a total of approximately 70 pounds, and even after I had my son, I had a very difficult time losing weight, so I stayed roughly about a size 16 to 18. And throughout the last 20 years, I would change my eating habits, change my activity, I would increase my exercise. I got so far as to get down to about 160, but it didn't seem like I could break any way below that. So roughly about 5 years ago, I considered a more drastic option. I started looking into weight loss surgery and things of that nature. After a lot of consultation, a lot of thought about the benefits opposed to the risks of the surgery, I contacted my doctor and asked for a referral for weight loss management. Now, this being a process from start to finish, it took about a good 6 to 8 months for me to get in to see the weight loss doctor, for me to meet all of the qualifications to get them to authorize the surgery. I had to lose some weight on my own. I had to, go through the whole blood panel. I had to get a gastric test done to see if I had anything going on with my stomach, or to rule out ulcers and stomach cancer and things of that nature. So it's a process. It's not something that you can go in one day and on Monday you're having surgery. So November of last year, in fact, the day before Thanksgiving, I went in for surgery and I actually had a gastric bypass. Just to let you know, at my highest weight, I was 257 pounds. And if you'll look at this picture, this is me from a year ago. Now, pan forward now, I'm several months after the surgery and I've lost roughly about 75 pounds, and I'm still working on my weight loss protocols. And just to let you know, I know we talked about some of the health concerns, just some of the a little bit more minor health concerns that people deal with when they're overweight are things like plantar fasciitis, which causes the tissue on the bottom of your foot to get inflamed, and it's extremely painful. You know, knee and joint pain, back pain. You know, there's like all those little, you know, damage to your cartilage and things like that, tendon damage. So not to mention, it can really have an impact on your self-esteem. It's a long process, and I would never recommend anybody just jump to surgery overnight, but it's definitely something that I worked up to after approximately about 20 years of having a weight condition. So I'm still not where I want to be, but I'm very much getting closer and closer to my goal with about 25 to 35 pounds to go. And it's amazing how it can impact the way you feel about yourself. You know, my goal is freshly inside, and I'm super excited. So that's my personal testimony on the subject of obesity. And just for your reference, the sources that I utilized for my showcase include the CDC, specifically Obesity in America, February 27th, 2020. I utilized my Medical Terminology for Healthcare Professionals school book, the 7th edition. I also utilized an article that I got from the National Institute of Diabetes, Digestive and Kidney Disease, niddk.nih.gov, February of 2018, for the treatment of overweight and obesity. Thank you.